Hey everyone, this is Dr. Serena from Treat Yourself to Health, and today we are going to be talking about insulin resistance, one of my favorite topics, something that I've had an expertise in for many years. I did my residency in internal medicine at the New England Deaconess and Beth Israel Hospital in Boston. It's one of the Harvard hospitals, and rotated through the diabetes hospital there every year when I was in residency. So they were making sure that we were going to be experts in managing diabetes. Deaconess Hospital there is one of the places in the country that's known for its expertise in diabetes management. So, when I had that exposure in internal medicine residency in my first residency, I thought that some of the things that we were doing didn't make sense. Like, for instance, allowing people to eat anything they wanted, especially like the teenagers eating candy and junk food. That just didn't make sense to me, and the philosophy that was taught was that you can just treat everything with insulin. Well, now we know the more insulin either your body is making or that you are taking from the external, like a drug, then it's worse on your metabolism, on your liver. It just makes the whole situation worse. What you want to do, and the ultimate goal, is to reduce how much insulin your body is making and reduce how much you are taking if you're taking it. Now, of course, we have disclaimers here. I'm not here to recommend treatment for you specifically. You need to consult your primary care or your endocrinologist about what you individually should do. But I'm just saying that the overall goal, generally, even if you're insulin dependent diabetic, we've learned over the years that if we can keep the amount of insulin that you're taking down to, exactly and precisely what you need and not a whole bunch extra, that your outcomes are better, or our outcomes are better. So, did you know that over 88 million Americans have insulin resistance, and most don't even know it? And here's the kicker. It's not just about blood sugar. It's about brain fog, fatigue, weight gain, and also your risk for cancer goes up. The good news, you can reverse insulin resistance naturally. In today's video, I'm going to show you 6 powerful evidence-based ways to take control and start right now. So if you're new to our channel, can you please subscribe? Hit the button below that says subscribe. Hit the thumbs up button. And also, if you can comment, that really helps in the algorithm, as they say, and helps boost the video so that other people can see it that want to know about the information. So the first place to start is, of course, with nutrition, which is also one of my favorite topics. And it's starting with what's on your plate. And processed carbs, added sugars are like pouring gasoline on the fire. So if we can swap them out for fiber-rich vegetables, healthy fats like avocado, like olive oil, clean proteins like wild-caught salmon, lean, organic and pastured chicken, and other meats. Also, adding cinnamon and apple cider vinegar are some natural interventions that will help to bring your blood sugar down and stabilize the blood sugar. So, here's a tip. Break your sugar habit with one simple switch. Eat more fat and fiber at breakfast, and it'll help stabilize your blood sugar all day. So, another thing that I want to mention right off the bat here is that the latest research has shown us that the problem with the blood sugar balance is actually originating in the microbiome of the gut. And you may have heard of, there's a brand that Halle Berry has been promoting. She's diabetic, and she takes Artemisia from this particular brand. I'm not going to mention the brand, but you can do your own research. And Artemisia is a particular probiotic, and it's not the probiotic that is going in and inhabiting your gut. It's actually creating the environment so the balance can restore. Your microbiome, or the microbes in the digestive system, are all about balance. And those go, if you think about, we have lots of little tubes that are leading to like the liver, the gallbladder, the pancreas. So your whole digestive health depends on those microbes migrating up into the tubes and inhabiting the areas where they need to be and being in the right balance. So let's talk about next. We're going to talk about stress and cortisol. Another one of my favorite topics because it ties into so many hormonal imbalances and imbalances in the metabolism, or how we are breaking up, the nutrients from the food that we're eating, etc. So high cortisol levels make your body store belly fat, and it causes spikes in the blood sugar. There's an effect on the liver where the liver, when it gets exposed to more cortisol, is going to release sugar and break up the fats that are in the liver to make more sugar. So this causes your blood sugar to go up. Ever notice like that you crave sugar when you're stressed out, when you're overwhelmed, when you haven't slept well? And that's your body trying to self-soothe. So breath work, meditation, even 10 minutes of sunlight in the morning can help to lower your cortisol and boost your insulin sensitivity. So when we have a high blood sugar, if we've had that problem over time, it can cause the cells to be resistant to insulin. And that's what we call insulin resistance. So the cell's sitting there and the insulin's trying to get in, and your body has to make more and more and more insulin to get inside of the cell. And typically that cell is inflamed, and that is what is causing the insulin resistance. But it can also be from hormonal imbalances. So we need to make sure that we're getting all of that addressed. So next, I want to talk about, I mentioned probiotics, and probiotics, or biotics, microbes, they eat prebiotics, which come from fiber, and they aren't just for digestion, it's also for metabolism. So a healthy gut microbiome actually improves how your body uses insulin. And I mentioned that it also affects your blood sugar balance. And they are thinking from the latest research that it is these microbial imbalances that are actually contributing to the diabetes and causing the diabetes. And they've specified that there are certain microorganisms there that are contributing to that. So what we see is an imbalance of the microbes in your internal digestive system. So what can you do about that? You can add fermented foods like kimchi, sauerkraut, prebiotic-rich foods like garlic, onions, asparagus, and things like hearts of palm and artichokes have inulin. And inulin is one of the main foods that the bacteria like to eat. So talk to your practitioner about what probiotics might work best for you. I like to put people on, I like to use soil-based probiotics, things like seed, like Microbiome Labs, Megaspore Biotic. Those are some of my favorite products. And then we have the next thing I want to talk about are hidden toxins and infections. So what most people miss, or when they're trying to address this themselves, they're not aware that there are so many toxins in our environment, in our food, in our water, and there are also chronic infections that can drive insulin resistance. So think about we are always talking about the plastics, the microplastics. There's also macroplastics, mold in your home, There are hidden infections like viruses that can overload your immune system, and of course, Candida and yeast, which are commonly seen when people have insulin resistance. So, we want to detox gently, doing things like sweating, in saunas, in hot baths, supporting the liver with milk thistle, dandelion tea. There are a few other things. And getting tested if you suspect chronic infections. And you're going to need to see some type of practitioner, because I guarantee you, if you start trying to order virus panels on your own, you're not going to understand the results because they can be complicated to interpret. And also, you're probably going to miss looking for some things. It takes an interview and also a physical exam to be able to best hone down what we're testing for. It can also drive up the cost of the test if you're just testing for all the viruses. That's not a smart way. So that's what we're here for, and we can help you with that. You don't need to rely on medications alone if you're trying to address your insulin resistance. Now, insulin resistance, like if you're talking to your primary care doctor and you're trying to figure out if you have insulin resistance, you need to get your A1C tested, which is one of the excellent tests that we can do to look at what your average blood sugar is over the past several months. There are other inflammatory markers that we look for in the liver, in your cholesterol numbers, and there's certain profiles with the cholesterol that we are looking for. And then there are also inflammatory markers that give us a clue, like looking for your CRP, HSCRP, or the high sensitivity CRP. So, if you've seen a functional medicine doc before, which is what I do in my practice, or if you've seen a doctor that's integrative, these are things that we normally look for, and your primary care is going to look for some of these things, but not all of them. And really, we like to see as many markers as we can, as many biomarkers, so we can confirm what we suspect. We don't just want to see one biomarker, we want to see multiple biomarkers that confirm what we suspect. And in primary care, they are not going to order more labs than they think your insurance will pay for. And nowadays, insurance doesn't really pay for that much at all. They don't want to do these inflammatory markers because then it's like going down a rabbit hole and they don't really know where to start if it's high. And so many people have high CRPs and high sensitivity CRPs. So just so you know, and insurance costs, of course, are going up, and that's because a lot of us are out here asking for tests that are unnecessary. So do yourself a favor, ask your doctor for this one test, the A1C, which they can get once every 3 or 4 months, once a quarter. They can't check it on you every month, but if you ask for a cash lab, which there are many cash labs out here where you can order your own labs, you can order your own labs online. You can check it every month if you want. You can check it after a couple of weeks if you want. The A1C is generally under $10, so it is a well invested, it's a good investment to pay for it if you have an abnormal A1C.